So first of all, I would like to thank all my research team members and the support from AIDS Concern, and also the funding support from the AIDS Trust Fund. Okay, so first of all, I will quickly go through the background of our study. So why do we come up with such an idea? So we all know about the importance of HIV self-testing. So it was considered as one important strategy to achieve the 395 targets established by the UN AIDS. And but sometimes there are concerns related to the HIV self-testing. So one of them is lack of the counseling. So although very convenient, so some HIV self-testing users, they may skip the pre-test and or post-test counseling. So that will result in some issues. For example, like the incorrect procedures that will lead to some invalid results. So if you have tried HIV self-testing before, when you open up the package, then you read the instruction, and the form was very small, and sometimes the instruction was not very clear. And also, another bigger issue is that the inadequate support for the users, especially when you are tested to be HIV positive. So imagine, so when you're doing HIV self-testing in the midnight at home and you turn out to be positive. So what should we do? So what should we call? Okay, so it was at the midnight and nobody can help. So, and also these issues, so they lead to the problems of the linkage to care. So according to previous literature, so for the HIV self-testing, so the linkage to care was lower than the standard of care facility-based HIV testing and counseling service. And also there are studies show that the self-testers, they consistently wish that the pre-test and post-test counseling for HIV self-testing to be available. So we are now clear that we need to provide some kind of counseling support for the users, but how? So there are two major ways for providing the counseling support. So one, we call it active counseling. So that means we proactively provide counseling to all the users, so unless they refuse that kind of service. And in contrast, another type, we call it passive. So we just wait there, okay, wait for the HIV testers to come out to find us, okay? So we do not provide any active counseling to users, but they can report the result via some web-based platforms, and they can obtain some optional counseling. And my PhD, Edwin, he did a meta-analysis about the type of counseling support among the MSM HIV testing users and the link to care. And we find that, so in fact, so nowadays, a majority of the HIV self-testing service, they are providing some kind of active counseling support. So as you can see the number, so 50 studies providing active support as compared to only 5 studies provide some passive support. So when you're looking at the link to care, so among between these two types, we can find that, so if we provide active counseling support, we can have significant higher linkage to care, such like the linkage to laboratory confirmation, ART initiation, and also referral to physicians. So now we're clear that we need to provide counseling support and we need to provide active counseling support. But how can we provide active counseling support? So in our previous project, so we develop and implement a home-based HIV self-testing service. So we call this service we called it. It has a real-time counseling support. So via some live chat application. So we mail out a free HIV self-testing kit by mail, or they can also pick up through some pickup service. Then upon the appointments and experienced HIV self-testing administrator will provide online real-time instruction and the pre-test and the post-test counseling via some live chat application, such as WhatsApp, Line, or Skype. So it has some strengths. So we evaluate this new service through using the randomized control trial, and we find that it can significantly increase the HIV testing uptake. And also, it can ensure very good linkage to care. And also, it can reduce the sexual risk behaviors. And this, we call it HIV OIC. HIVST-OIC, it was also listed as one of the evidence-based structural intervention by the US CDCs. But during the implementation, we find out there were some issues. So so usually, as I mentioned, so the people like to do HIV self-testing at home during midnight or even during the holidays. So it's not always hour, okay? So so it created a very big challenge for the HIV self-testing administrators. So nobody can work 24 hours per day, okay? So especially for our NGOs, okay? And each section, it will take about 40 to 60 minutes to implement. So, it was quite resource demanding. So that's why it is very difficult to implement at a larger scale. And how we can overcome these implementation issues? So, and the chatbot actually come into our site. So, so I think everyone know what is chatbot. So it is a computerized program. So it was act to replicate the human interaction. It can through the text, speech, or even the visual forms of communication. So in the recent days, so the use of large language model and the machine learning, it largely increased the accuracy of the human-machine interactions. So there are a lot of advantages of using chatbot because it can offer some personalized, engaging, and on-demand health promotion. And it can also proactively interact with the users, so which can improve some compliance. And more importantly, it's fully automatic. So if it is in place, so it requires fewer resources to maintain or implement. So we have the idea, so we are trying to use the chatbots to deliver this kind of online real-time instruction and counseling support to support the HIV self-testing users. So our project, we do have two phases. So the first phase is to the development of the chatbots, and the second phase is the evaluation of the chatbot. So in the second phase, we compare our HIV self-testing chatbot versus our human service, the HIV self-testing OIC, and to see which one is better. So there are some specific objectives for the second phase. So the primary objective is to establish whether the HIV self-testing chatbot will produce some similar effects as compared to the HIVST-OIC in increasing the HIV self-testing uptake, as well as the proportion of HIV self-testing users receiving the counseling along with the testing within a 6 months follow-up period. And our secondary objective is to test the between-group difference in the prevalence of sexual risk behavior, like the condomless anal intercourse, the multiple sex partnership around the self-testing users, as well as the uptake of other HIV testing other than the HIV self-testing during the follow-up period. So then I will talk about the methods. So this is how we develop our chatbots. So we use a community participatory approach to develop the chatbots. So we interview our end users, so the MSMs, as well as the HIV testing administrators. So we crowdsource a lot of common concerns and frequently asked questions related to HIV self-testing and HIV testing. And we also try to understand the potential users' preference and their expectation about the chatbot. So by taking this into account, so we use the WhatsApp to implement the chatbot. So why we chose WhatsApp? Because I think it's the most popular instant messaging apps in Hong Kong. It's almost 90% of the Hong Kong people are using WhatsApp. So the technical barrier will be lower. So this is the architecture of our chatbots. So the chatbot has two parts. So one is the chatbot system, and the other is an administrative system. So when a user sends a message to the WhatsApp, and the WhatsApp will forward the message to our chatbot system. Then the chatbot system will process the message based on our predetermined rules and send a response back to the WhatsApp server. And the WhatsApp server will then show the message to the users. So the whole process will last less than a second. So, and the users will not feel any sluggish. Okay. And when the chatbot was in place, so we conduct a pilot testing. So we invite 30 MSM to use the chatbot, and their conversation with the chatbot was retrieved by the research team, and they will review, and we've improved the performance of the chatbot. So here's the workflow of our HIV self-testing chatbot. So basically, we are simulating standard of care pre-test and post-test counseling. So the first part for the pre-test counseling, first of all, is a risk assessment. So the chatbot will ask some standard questions to assess users' HIV risk, and the participant can answer the question in a very flexible manner. So they can either select the response by clicking a button on the screen, or they can key in their answers, or they can use voice message. So it's quite flexible. And then the chatbot will interpret their response and then define their risk level. And the second part, the chatbot will provide some health education advice tailored to their risk level. And first of all, it will inform the users about their risk level and explain the rationale. And for those who are at high risk, the chatbot will prepare them for the potential positive results. For example, by explaining how effective the HIV treatment it is, and what they need to do if they obtain a positive result, and also our support for the HIV, for those who are tested to be HIV positive. And for those who are without high risk, the advice on maintaining safe sex practice are provided. And then you will obtain the consent to perform the HIV self-testing. So the chatbot will ask whether they are ready for it, and the users at this moment they can raise their concerns or questions. So they can they can either select their question using. We have a list of FAQs. Okay, so that was created based on our previous work. So the most frequently asked questions. So they can select one or more questions related to HIV self-testing or HIV testing. If their questions are not in the list, so they can enter the questions in the chatbot, and the chatbot will retrieve the keywords and to get the response from our QA database and send the response to the users. So, and then with the consent, the chatbot will play a pre-recorded online demonstration video showing the procedures of using HIV self-testing kit. So the user can either watch the demonstration for the oral fluid kit or the blood-based kit, so it was based on their preference. And then after they have the testing results, so we ask the chatbot will ask all the users to report their testing result. So they will need to answer questions, multiple choice questions, and the chatbot will show the example of the positive, negative, and also the invalid results to help the users to interpret their results. And also, the chatbot will ask the users to take a photo of their testing result and upload it to a secure web page. And the web page will be an analysis to confirm their testing result. And then, based on their testing result, the chatbot will provide the post-test counseling. So for those with negative results, the chatbot will explain the users now is not infected unless the test was taken within the window period, and was remind them that the second screening is required after the window period. And also, they will remind them about the risk of HIV infection and provide some tips or advice about their safe sex practice and emphasize the need of regular HIV testing. And for those with HIV positive result, so the chatbot will automatically notify a designated supporting staff from the collaborative NGOs, and which will follow up with the users as soon as possible. So, and at the same time, the chatbot will explain, so this is a preliminary positive result, so they need to take a confirmatory HIV testing at the Department of Health. And also, staff from the NGOs is concerned. is already notified by the system and will follow them as soon as possible. And also, it will emphasize again about the effectiveness of the HIV treatment, and also we will provide the hotline number of some 24-hour emotional support, and also the hotline of our NGOs. And our project staff can accompany them to visit the NGOs or Department of Health if needed, so to ensure sufficient support was given. And also, we consider, so because now the HIV self-testing is quite popular, some of the MSM, they already have some rich experience of using the HIV self-testing. So they may not need comprehensive instruction and counseling. So they can feel free to choose 2 different service models. So the first one, mainly for the first-time users, we call it comprehensive counseling. So it is a standard of care pre-test counseling and the report of interpretation of a result and the post-test counseling. And for those who already have the experience, so they can choose the simplified counseling. So they can skip the pre-test counseling, they just directly report their result, and the chatbot will interpret their result and provide the standard of care post-test counseling. And all of the users, they are strongly recommended to report their testing result. And so here, this slide shows the participant of this phase 2, which is a non-inferiority randomized control trial used to evaluate the HIV self-testing chatbot. So we mainly recruit the MSM, age 18 years or above, and they have access to WhatsApp and no intention to leave Hong Kong for 1 month consecutively within the next 6 months. And those who were already diagnosed as HIV positive were excluded. And this was the flow chart. So we approached to 620 MSMs through multiple channels, and 531 agreed to participate in our studies, and they were randomized into the chatbot group and also the HIVST-OIC group. And in the chatbot group, so they will watch an online video promoting the HIV testing in general as well as the chatbot, and then they will be connected with the chatbot and then implement the service. And for those in the HIVST-OIC group, so they will watch a similar video promoting HIV testing in general as well as the human service, and then they will make appointment with the HIV testing administrators and then implement the service. And all participants will follow up 6 months afterwards. So our primary outcome is the self-reported uptake of any HIV self-testing and during the follow-up period, and also the proportion of the HIV self-testing users who have received counseling support along with the self-testing during the follow-up period. So these outcomes were validated. We try to validate the outcome because the chatbot will document the number of the HIV self-testing chatbot use, and the HIV testing administrator will record the number of the human service that was performed. And the secondary outcome include the condomless anal intercourse and the multiple sex partnership among the HIV self-testing users, and also the uptake of other type of HIV testing among all participants during the follow-up period. And let's look at the result of our studies. So majority of our participants were young, currently single, highly educated, fully employed, and identify them as gay. And the sexual risk behavior in the past months was comparable to the PRISM. So it's about over 50% of them report condomless intercourse and anal intercourse and multiple sex partnerships. And less than half of them use HIV testing in the past 6 months. And at month 6, so we can find 194 participants in the chatbot group use any type of HIV self-testing, so which is similar to the HIVST-OIC group, which is 74%. So when we look at the type of HIV self-testing taken by the participants, so majority of the HIV HIVST users, they use the service provided by this project, so either the HIV self-testing chatbot or the HIVST OIC. And about 5% of them also obtain the HIV self-testing from other sources. And during the follow-up periods, it's about 16% in the chatbot group and 90% in the OIC group. They take up other type of testing. So if we count all type of testing, so the uptake rate is about 77% in the chatbot group and similar in the OIC group. So our hypothesis of the inferiority was proven. So which means the chatbot is non-inferiority to the OIC, the human service, in increasing the uptake of HIV testing. So we also conduct some subgroup analysis, and we find that there were similar trends in the HIV self-testing uptake among those with and without sexual risk behavior at baseline and those with and without HIV testing in the past 6 months at the baseline. So it's quite consistent across different subgroups. And interestingly, when we look at the proportion of HIV self-testing users receive counseling support, we find that significantly higher proportion of HIV self-testing users in the chatbot group receive any type of counseling. So it's over 90% of those in the chatbot group receive any type of counseling, so which is 30% higher than those in the human service group. So the OIC group is only 61%. So the proportion of using simplified counseling, which means the post-test counseling alone, is not, we did not find significant difference between groups, but the difference occur in the comprehensive counseling. So with about 35% of the users in the chatbot group, they use the comprehensive counseling support. So, and only 5% in the OIC group use that kind of comprehensive support. And it is encouraged to find that, so 100% of the HIV self-testing users report their HIV testing results to us. And when we look at the trend and in the sexual risk behaviors, so at baseline, so there is no between-group difference in the sexual risk behaviors, but at month 6, the chatbot group has the prevalence of condom-less anal intercourse was significantly lower than the HIV self-testing user in the OIC group. And when we compare the within group difference as compared to the baseline, so both groups have significant reduction in the sexual risk behaviors. Okay, so we do find 2 HIV positive cases using the HIV self-testing chatbot. So for the first case, the users self-reported having a positive HIV self-testing result. And he also uploaded a photo, but the photo after analysis was in fact a negative result. But no matter, so either option will trigger our following up actions. So the HIV self-testing chatbot so immediately notify our project staff and provide the relevant information. And the project staff contact the users in the next morning because he did the HIV self-testing at midnight. Okay, so our project staff contact him in the next morning. And we arrange a confirmatory testing at his concern, and luckily he was confirmed to be HIV negative. And for the second case, the user self-reported having a positive result and also upload a photo with a positive result. And the chatbot will use and immediately notify the project staff, provide the supporting information, and we contact the users and arrange a confirmatory testing. But he was also confirmed to be HIV negative. So it may be the issues related to the oral food HIV self-testing kit. Okay. So as a conclusion, so we find that our chatbot is quite feasible and highly acceptable to deliver some real-time instruction and counseling support for the HIV self-testing users. And the randomized control trial proved that the chatbot was non-inferiority to the human service in improving the HIV self-testing uptake among men who have sex with men. And interestingly, we find that more HIV self-testing users in the chatbot group receive counseling along with the HIV testing, especially for the comprehensive counseling support. And the chatbot can ensure good linkage to care among the users. And both options, either the chatbot or the human service, are able to reduce sexual risk behaviors among the users. Okay, so this is the end of my presentation. I'm wondering whether I still have 1 or 2 minutes. Okay. So okay, okay, sure. So. Okay. So thank you very much.